Welcome back to Diabetic Foot Files. I'm your host, Dr. G, your podiatrist, wound care specialist, and limb-salvage activist. Today's episode is called No Soaking. And yes, no soaking. Simple as that. Because if I had a dollar every time a patient told me I've been soaking it in warm water and salt or soaking it just randomly, yeah, I would be the next Jeff Bezos. Yeah, I would be. Okay? I would fund a whole limb salvage research by myself if I had a dollar for every time I heard that. So this is episode is I think let me just on a side note, I think soaking a wound or a foot that has a wound or problems is like a urban legend. That's what I think it is. It sounds like it's an urban legend because it's one of the most persistent yet harmful myths when it comes to wound care, in my opinion. Okay, everybody has opinion. I'm entitled to opinion. Okay, but this will silently destroy your tissue, in my opinion. Okay, it doesn't. It doesn't help, in my opinion. And I'll tell you why I came to this conclusion. But it just seems like it's something so persistently told to patients, unfortunately, that causes more harm than good. So where did this soaking myth come from? Let's start from like a little bit with history because this myth didn't come out of nowhere. So before antibiotics, before sterile technique, before they understood bacteria, warm water was used to remove debris, loosen dirt, provide comfort, and then also help reduce visible contamination. And then salt was added to it because it was available, but it wasn't because it was evidence based. But salt was never an antiseptic. Salt was a preservative for food, not for tissue. And the important distinction is soaking was used for dirty skin, not for open wounds. Okay. And somewhere along the way, that distinction got lost. So why does soaking feel good? And I'm not the advocate. I don't want you to soak your foot. Okay. Do not. So now let's talk about why patients swear by soaking because I'm telling you not to soak, okay? Warm water causes vasodilation. It temporarily relaxes the tissue and it dulls the nerves, okay? So the patient says, oh, the pain feels better, the tightness feels better, the swelling feels better temporarily. But in wound care, it's not about the comfort, it's about the biology. So, what happens when you actually soak a wound? So, let's get serious about what's exactly happening to the wound when you soak it. Because I'm telling you, stop it. Don't soak it. Okay. If anything you get from this, even if you mute me out, all I want you to know is don't soak your foot. Please don't. But what happens when you actually soak a wound? Because I feel like people will be less inclined to do that or listen to this little urban myth, and it can help save some feet, in my opinion. And if you understand what's going on. So, maceration. I think a lot of patients know that term maceration, but maceration is when the skin is exposed to prolonged moisture. It becomes what we call macerated. So, macerated skin has loose tensile strength. It breaks down faster. It cannot hold in sutures. It cannot protect its edges. Okay. And a wound that can't close if the edges are dissolving because it's too moist, don't expect the wound to close. Next, barrier destruction. Your skin is a barrier and it's lipid based. Warm water strips lipids. Salt disrupts the osmotic balance. So, when you soak a foot, you're not really cleaning the wound, you're removing all its defense mechanisms, pretty much. Not all of them, but like I said, the skin is lipid soluble. If you're putting it in warm water, you're stripping the lipids, and the salt disrupts the osmotic balance. Next, bacterial proliferation. Warm water does not kill bacteria. Warm water is a growth medium for the bacteria. If you add salt, the salt is not sterile. That causes contamination. So, soaking introduces bacteria from the sink, the basin, from your hands, and the environment. Okay? So, you're literally creating a growth medium for the bacteria. They like that. They like the warmness. Next, edema worsening. So, Soaking increases interstitial fluid. Edema increases diffusion distance for oxygen. So, more swelling equals less oxygen, which equals slower healing. So, that's what happens. Now, I have a quick little story. I won't say when or where, but I remember a patient, her mom had leg ulcers and they were just worsening, getting bad. And I understand. I try to be thinking of Atticus Finch when they say put yourself in the person's shoes. I understand why they thought that it probably is a venous stasis ulcer. I get that. But the patient actually had critical limb ischemia. And I'm pretty sure we talked about critical limb ischemia. Actually is one of the most painful conditions you can have. Your body does not have enough oxygen or arterial flow, and the tissue is slowly dying. It's being slowly strangulated. So it's extremely painful. And the patient told me that their the person who was changing their wounds, which is I don't think it was a physician. It was either like some type of healthcare professional, but I don't think it was the physician. Told her to soak her mom's foot in warm water and salt. A critical limb ischemic foot, both both limbs and legs. Soak it. Yeah, no. I stopped in middle when she told me that. I just stopped and paused, and I was like, I beg your finest pardon. They told you to soak a ischemic leg in water daily? Okay. Yeah, no. She was looking at me, she's like, "We're not supposed to do that." I was like, "No, please don't. Don't ever do that again. Please don't." It's already wet and showing signs of wet gangrene, and the professional was telling her to soak it more. Yeah, don't ever do that again. It's not the patient's fault. I even understand where the professional was coming from, but don't ever soak. When in doubt, don't soak. When in doubt, don't soak it. Okay, simple as that. But let me talk about the pathophysiology. What happens when you're soaking a wound in a critical limb ischemic leg? Okay, so baseline. Critical limb ischemia is defined by severely reduced arterial flow, critically low oxygen tension, so the PO2 is very low, impaired nutrient delivery, impaired immune cell trafficking, impaired waste removal. So critical limb ischemic tissue exists at the pretty much at the edge of cellular survival. It's literally almost dead, okay? So, when you're putting a critically ischemic limb in in water, soaking it in water, please don't do this. What's happening is you're causing excessive moisture, which will cause maceration, and you will continue to cause skin breakdown because you're breaking down the barrier. Soaking causes prolonged hyperhydration of the epidermis and the wound edges. So, what are the cellular effects of that? Disruption of the keratinocyte adhesions because we need keratinocytes to come together to make the skin, right? There are going to be breakdown of the desmosomes and the tight junctions. There's going to be lipid bilayer dissolution at the stratum corneum and loss of tensile strength. Tensile strength, remember, even if your wound fully heals, it will never be at that 100% of tensile strength that it was before the wound even happened. So what is the consequence of all this? The peri-wound skin softens and sloughs. The wound edges widen, so the wound will become bigger. The epithelial migration slows down or even halts, and the mechanical trauma threshold drops, okay? And this wound physically enlarges instead of closing. Next, the edema formation that causes microvascular collapse. So the water immersion creates an osmotic fluid shift into the ischemic tissue because the ischemic tissue doesn't have much fluid. So the pathophysiology of that, there is interstitial fluid accumulation, and that increases the tissue pressure. And that compression is already in these fragile capillaries because they have critical limb ischemia, and this will cause lymphatic stagnation. So, in this critical limb that has ischemia, the perfusion is already low. So, any increase in the interstitial fluid will collapse the capillaries, which will cause further reduction in the oxygen and nutrient delivery to that tissue. Okay, so you're pretty much worsening the condition. Next, remember, it's a critical limb that has ischemia, critical limb ischemia. Just equate it with very, very low tissue oxygen, okay? And low perfusion, like blood flow to that area. So if you soak a limb that has critical limb ischemia, you're literally worsening the tissue hypoxia. The tissue diffusion goes down. Healing requires oxygen, as we know. That's why I'm a big topical oxygen advocate. I love it. So healing requires oxygen for fibroblast activity, collagen synthesis, angiosynthesis, bacterial killing, right? But if you're soaking the foot, you're worsening the hypoxia by increasing the diffusion distance by edema. You're reducing oxygen availability at the wound surface, and you're pretty much creating an occlusive low oxygen environment. So what's going to happen? What's going to be the result of that? Fibroblasts shut down, oxygen synthesis stop, and angiogenesis fail. Next, metabolic mismatch and cellular energy failure. So warm water immersion increases the local temperature, it increases the cellular metabolic demand, it increases oxygen consumption. But in a limb that has critical limb ischemia, the tissue cannot increase its oxygen delivery. So the result will be mitochondrial hypoxia, failure of the oxidative phosphorylation, ATP depletion, accumulation of lactate, and cellular apoptosis, which will result in necrosis. So the cells will die faster than they can be repaired. I hope everybody's understanding this. Next, dysregulated inflammatory cascade. Soaking stimulates mast cell degranulation, histamines release, increase in capillary permeability, and cytokine release, which is like TNA alpha, IL-1, IL-6. So in healthy tissue, inflammation transitions to proliferation. But in a ischemic tissue, it does not. The ischemic tissue, the wound will become stuck in a chronic inflammatory phase. The protease dominant environment and extracellular matrix will break down, succeeding to synthesis. Next, see, a lot happens when you soak a ischemic foot. Please don't do it. Next is autolysis without clearance. So soaking promotes tissue softening, right? That's why people soak things. They trying to soften it, loosen it, right? And you're trying to get the skin put back together. So why would you soak it? So soaking promotes tissue softening and autolytic processes. But in a critical limb that is ischemic, the macrophage recruitment is impaired, the neutrophil function is reduced, and debris clearance is inadequate. So what will happen is the slough will accumulate, necrotic tissue will persist, and the protease activity that will continue to destroy the healthy tissue, any healthy tissue that is still there. Next, infection and biofilm promotion. You're literally giving the bacteria promotion. So warm, moist, hypoxic environments favor anaerobes, facultative anaerobes, and biofilm formation. So biofilms, what do? They reduce the antibiotic penetration. Okay, remember that's their little guard and shield. It suppresses immune recognition and increases virulence persistent. So local infection risk will rise sharply, and dry ischemic tissue will convert to get wet gangrene. And remember, we do not want it to convert to wet gangrene, but if you're doing that, it will. Next, reduce antibiotic and immune effectiveness. Edema and low perfusion causes poor antibiotic tissue penetration, reduced leukocyte delivery, impaired oxidative burst, and the infection becomes harder to treat. And it can progress to a deep space infection and will possibly progress to the bone where you are at high risk of osteomyelitis. Mm. So what is the net effect of soaking a foot in during the wound healing phase? You're going to disrupt the hemostasis phase. You're going to prolong the inflammatory phase. You're going to suppress the proliferation phase, and pretty much the remodeling phase will be pretty much absent. So soaking a foot with critical limb ischemia will pretty much halt the healing phases, and the healing physiology will never progress. But in final summary, soaking an open wound in a critical limb ischemic limb, okay, causes epidermal barrier breakdown, edema, induced microvascular collapse, worsening of the tissue hypoxia, mitochondrial energy failure, chronic inflammation, impaired immune response, increased infection and biofilm formation, and accelerated necrosis. Let me say that again. Accelerated necrosis. So, long story short, in a critical limb ischemia, soaking an open wound increases maceration, edema, hypoxia, metabolic demand, inflammation, and infection. So you're biologically converting marginally viable tissue into necrotic non-healing tissue. Okay. So in the end, all you have to know is soaking is bad. Don't soak the foot. Okay. So let's also, when soaking in a diabetic foot, why is soaking extra bad for that too? Neuropathy. Patients do not know how hot the water is. So you're soaking and you're burning your foot at the same time. And like we went through with the peripheral arterial disease, a lot of diabetics have microvascular disease. So their arterial function is impaired as well. And maceration in a diabetic foot can also equal ischemia. Y'all have to get me tongue tied, and that will result in necrosis. Okay, so I just don't recommend it. I know I do tell patients to soak their toe when it comes to after ingrown procedure, but only that one day for less than 5 minutes. But if not, then don't do it, okay? Do not soak a diabetic foot also. Do not soak a wound. I do not soak it. In my opinion, just do not soak it. What do you want to do instead? Okay? Instead of soaking it, correct wound hygiene. Gentle cleansing with either a wound cleanser or saline. Pat it dry with sterile gauze. Protect the peri-wound. That's another thing people forget to do. Protect the peri-wound. What is the peri-wound? The wound, the skin around the wound. Okay, you want to make sure that that skin integrity is nice, stable, and dry, so that if something happens, the wound does not open up and continue to progress. Right? Because a moist healing wound does not mean it's wet. Like I know we say moist balance, but no, we're not talking about over moisture of it. Okay. So, what do boards like to hear? S- The fact of the matter is, soaking causes maceration. Maceration delays epithelialization. Warm water increases bacterial growth. Salt water is not sterile. That's another thing. Patients like to go to the beach and just soak their foot in it. Stop doing that. You're going to end up in the clinic or in the ER. Okay. Think about the vibro bacteria. And then diabetic feet should never be soaked. Never soak a foot that has diabetes. I would never. Don't ever soak a foot that has diabetes. Don't ever soak a foot that has poor arterial blood flow. Never soak a foot that has critical limb ischemia. So let's do some quick forward questions quickly. Okay. A patient with critical limb ischemia is instructed to soak their foot daily in warm water for an open plantar ulcer. Which of the following mechanisms most directly explains delayed wound healing? Is it A, increased fibroblast migration, B, enhanced collagen cross-linking, C, increased tissue oxygen tension, D, maceration leading to epidermal barrier failure, or E, improved leukocyte chemotaxis? D, it's going to be maceration leading to epidermal barrier failure. So, soaking leads to maceration, disrupting the keratinocyte cohesion and the epidermal barrier integrity, leading to more wound edge breakdown and delayed epithelialization. Next, why does soaking an ischemic wound worsens the tissue hypoxia? Is it A, water increases arterial inflow resistance, B, hydration improves oxygen diffusion, C, edema increases diffusion distance for oxygen, D, water sterilizes anaerobic bacteria, E, soaking increases nitric oxide release? No. Answer is C. And if you let me just go through the question again. Why does soaking an ischemic wound worsen tissue hypoxia? It's C. Edema increases the diffusion distance for oxygen. So soaking promotes edema, which is swelling, which increases the distance oxygen must diffuse to reach the cells, which causes catastrophe in already hypoxic critical limb ischemia tissue. Now, microvascular physiology. In a critical limb ischemia, soaking an open wound most significantly worsens healing by what? A, increasing the venous return. B, causing capillary compression from interstitial edema. C, improving lymphatic drainage. D, enhancing nitric oxide mediated vasodilation. Or E, increasing growth factor availability. The answer is B, causing capillary compression from interstitial edema. So, edema from soaking raises interstitial fluid, which compresses the fragile capillaries and further reducing the perfusion. Next, which microbial characteristic is most promoted by warm soaking of a ischemic wound? Is it A, platonic bacterial growth, B, increased antibiotic susceptibility, C, biofilm formation, D, aerobic bacterial clearance, or E, reduced virulence factor expression? The answer is C, biofilm formation. So warm, moist, hypoxic environments promote biofilm formation, which increases antibiotic resistance and immune evasion. Next, why does soaking trap ischemic wounds in the inflammatory phase? Is it A, increases the prostaglandin inhibition, B, excessive mast cell degranulation without repair transition, C, decrease cytokine release, D, increase macrophage clearance, E, reduce neutrophil lifespan? It's going to be B, excessive mast cell degranulation without repair transition. So soaking triggers inflammation, but ischemic tissue cannot transition to proliferation phase due to the poor perfusion and poor oxygen delivery. So with soaking an ischemic wound, you're going to trap it in that inflammatory phase, okay? Due to the excessive mast cell degranulation without the repair transition. Okay, next. Warm water immersion worsens ischemic tissue injury because of what? A, it decreases mitochondrial respiration. B, reduces ATP consum- consummation. C, increases metabolic demand beyond oxygen supply. D, improves anaerobic metabolism. E, enhances lactate clearance. The answer is going to be C, increases metabolic demand beyond oxygen supply. So heat increases cellular metabolic demand, but ischemic tissue cannot meet that oxygen metabolic demand, which will lead to ATP depletion and cell death. So you're literally, pretty much when you're soaking it, you're giving it to the Grim Reaper. Okay? You're giving it to the Grim Reaper. Next, why is soaking induced autolysis dangerous in critical limb ischemia? Because I'm just going to say the answer, because necrotic tissue isn't cleared effectively. So autolysis occurs without adequate immune clearance in an ischemic wound, leading to accumulation of slough and necrotic tissue. Next, one that's common, soaking Epsom salts. Why does Epsom salt soaking worsens ischemic wounds? It worsens ischemic wounds primarily by creating an osmotic shift that increases edema. So magnesium sulfate draws fluid into the tissue, which is in the Epsom salts, and that worsens the edema and further collapses the microcirculation. Now, so- soaking an ischemic wound most directly increases the risk of what? Wet gangrene. Okay. Moist environments in ischemic tissue promotes infection and converting a dry necrosis to wet gangrene. And we do not want wet gangrene. Wet gangrene is unstable and will progress. Okay. ATP depletion in a soaked ischemic tissue occurs due to mitochondrial hypoxia. So reduced oxygen supply prevents mitochondrial ATP production, which leads to apoptosis and necrosis. Which wound characteristic after soaking a ischemic wound is most concerning? It's going to be C, pale macerated wound edges. Macerated pale edges signal hypoxia, barrier failure, and impending tissue breakdown. A patient that has critical limb ischemia with an open wound, the most important initial management step is to see revascularization assessment. Okay, without restoring the perfusion, no wound therapy will succeed in a wound that has critical limb ischemia. So you need vascular. Okay, so what's the takeaway? In critical limb ischemia, soaking an open wound increases hypoxia, edema, infection risk, inflammatory persistence, and cellular energy failure. Okay, which is directly opposing every requirement for wound healing. So I get it, soaking feels good, but it's not good for the wound, okay? And wounds don't heal through comfort, okay? So if every patient who says, I've been soaking it, is telling you that the wound's not healing, that's why also you're impeding the healing by soaking it, okay? So in wound care, tradition without evidence is kind of dangerous. So in the end, please don't soak the foot. Please don't soak the wound. Keep it nice, dry, and stable, and see your wound care specialist because this is diabetic foot files. Take care of your feet because they take care of you.